Good afternoon. This is All India Radio. I am Anuja Kumar and with me is Ishani Gupta with the Midday News. The headlines. Over 39 crore people receive financial assistance of 34,800 crore rupees under Pradhan Mantri Garib Kalyan Yojana. Karnataka announces 1,610 crore rupee package for farmers, construction workers, weavers, auto and taxi drivers. Government extends time limit for annual GST returns for the financial year 2018-19 till 30th of September. Prime Minister Narendra Modi takes detailed review of current status of India's vaccine development, drug discovery, diagnosis and testing for COVID-19. And recovery rate of COVID-19 patients reaches nearly 29%. Around 39 crore poor and needy people received financial assistance of 34,800 crore rupees under the Pradhan Mantri Garib Kalyan package so far. The package was announced by the Finance Minister Nirmala Sitharaman in March to protect the poor people from the impact of the lockdown imposed due to COVID-19. As part of the package, the government announced free food grains and cash payment to women, poor senior citizens and farmers. The implementation of the package is being continuously monitored by central and state governments to provide relief to the poor people. Fintech and digital technology have been employed for swift and efficient transfer of financial assistance to the beneficiaries.
Under the various components of the package, 16,394 crore rupees front-loaded towards payment of the first installment of PM Kisan to 8.19 crore beneficiaries. More than 10,000 crore rupees credited to 20 crore women's Jan Dhan account as first installment. Further, 2,785 crore rupees credited to 5.57 crore women's Jan Dhan account as second installment in this month. Besides, 1,405 crore rupees disbursed to 2.82 crore old age persons, widows and Divyangjan. A financial support of 3,492 crore rupees was provided to more than 2 crore building and construction workers. During April, more than 30 lakh metric tons of food grains have been distributed to 60.33 crore beneficiaries, while 6.19 lakh metric tons of food grains were distributed to 12.39 crore beneficiaries in this month. 2.42 lakh metric tons of pulses have also been dispatched to various states and union territories. Pulses have been distributed to 5.21 crore household beneficiaries. Under Pradhan Mantri Ujjwala Yojana, a total of 5.09 crore cylinders have been booked and 4.82 crore free cylinders delivered to the beneficiaries. With Bhupendra Singh, Anand Kumar, AIR News, Delhi.
In addition, 9.6 lakh members of Employees Provident Fund Organisation EPFO has taken benefit of online withdrawal of non-refundable advance from EPFO account amounting to 2,985 crore rupees. 24% EPF contribution transferred to 44.97 lakh employees account amounting to 698 crore rupees. Under the MG Narega scheme, 5.97 crore persons man-days of work generated and 21,032 crore released to states to liquidate pending dues. Insurance scheme for health workers in government hospitals and healthcare centres has been operationalised by New India Assurance, covering 22.12 lakh health workers. Karnataka Chief Minister B.S. Yediyurappa has announced a 1,610 crore rupees package for farmers, construction workers, weavers, auto and taxi drivers. Making the announcement in Bengaluru today, he said all those who incurred losses due to the lockdown will be compensated. The flower growers will get a compensation of 25,000 rupees per hectare. Washermen, barbers, construction workers, auto and taxi drivers will get 5,000 rupees each. Their electricity fixed charges for MSMEs will be waived off for 2 months, and a package will be announced soon to compensate fruit and vegetable growers. He also announced a new Naikar Samman Yojana that will provide 2,000 rupees financial assistance to the weavers. Meanwhile, the state government is making all efforts for the welfare of the stranded migrants and labourers. A report.
The Revenue Minister R. Ashok has said that the state government is trying to convince the migrant labourers to stay back in Bengaluru. He informed media persons today that 6,000 construction workers from Bihar were convinced today to stay back. He said food grains were supplied to them and and those not well were provided medical care. He also informed that 10,000 people stranded abroad have registered with a request to return to the state. In the first phase, 6,100 people will be flown back to the state and quarantined in Bengaluru for 14 days. According to the morning bulletin today, 19 new positive COVID cases were confirmed. Sudhindra, AIR News, Bengaluru.
Government has announced further relaxations for filing of annual returns for goods and services tax, GST and movement of goods in the country. The Central Board of Indirect Taxes and Customs CBIC has extended the time limit for furnishing of the annual return and GST audit for the financial year 2018-2019 till the 30th of September 2020. Government has also given an extension till 31st of May for all the e-way bills generated on or before the March 24th, whose validity were to expire between March 28th and April 15th. This relaxation will allow seamless movement of goods and supplies through road transport carriers, ensuring availability of supplies across the country. India is launching a huge evacuation exercise in the wake of COVID-19 to bring back thousands of Indians stranded abroad. Government sources said over 3 lakh people have registered in Gulf countries alone. The immediate focus will be to bring back Indians from the Gulf countries in neighborhood as well as from US, UK and Singapore. Sources also said External Affairs Ministry will share detailed database with states and central ministries for the possible employment of skilled workers as thousands of Indians are returning after losing jobs.
Indian Navy has launched Operation Samudra Setu, meaning Sea Bridge, as a part of the national effort to repatriate Indian citizens from overseas. Indian naval ships Jalashwa and Magar are presently en route to Malé in Maldives to commence evacuation operations from Friday as part of Phase 1. Indian mission in Maldives is preparing a list of Indian nationals to be evacuated by naval ships and will facilitate their embarkation after requisite medical screening. A total of 1,000 persons are planned to be evacuated during the first trip. The ships have been suitably provisioned for the evacuation operation. The evacuated personnel would be provided the basic amenities and medical facilities during the sea passage. The evacuated personnel will be disembarked at Kochi in Kerala and entrusted to the care of the state authorities. In Himachal Pradesh, regular inspections for welfare of labourers are being carried out across the state by field functionaries of the Labour and Employment Department. Our correspondent reports that complaints regarding non-payment of wages to the workers are being viewed seriously by the state government. A report.
So far, 1,373 inspections have been carried out to check any exploitation of laborers in the state. According to state government, more than 90% of the employers have paid wages and salaries to their employees. Daily inspections and monitoring are being carried out across the state by field functionaries of Labour and Employment Department. The state government has designated Deputy Labour Commissioner as nodal officer to redress the grievances of stranded migrant laborers working in the state as well as workers of state working in other parts of the country. Meanwhile, State Rural Development Minister Virendra Kanwar said that the state government has exempted daily wage local laborers engaged in harvesting of crops from curfew passes. However, laborers entering from other districts for harvesting purpose has to obtain curfew pass from respective district administration. Sanjeev Sundaryal, AIR News, Shimla.
Goa government is trying to arrange for the return of those migrant laborers who have registered online with the local authorities. Transit passes for their return will be issued this Friday. The state government has empowered 2 district collectorates to enlist the number of labourers stranded in Goa and who want to go to their home state. The Chief Minister has again urged the migrants to remain in the state as economic activities have again resumed.
In Rajasthan, the number of COVID-19 infected persons has gone up to 3,193, with 35 new persons found positive today. 22 cases reported from Jaipur took the total number of infected persons to 1,069 in the city. 1,536 persons have recovered and 1,131 people have been discharged from hospitals. 90 persons lost their lives due to COVID-19 infection in the state so far. Our correspondent reports that students, migrants, workers stranded at various places due to the lockdown are now reaching their destinations through special trains. A report.
Northwestern Railway has operated 6 special trains from 5 locations in the state so far, through which thousands of migrants stranded at various places have reached their destinations. A special train has reached Jaipur junction this morning carrying Rajasthani migrants from Bengaluru. Yesterday, 2 special trains were reached Jaipur from Maharashtra. After the health checkup of all the migrants, they have been sent to different districts by buses. On the other hand, the work of sending students studying in various coaching institutes of Kota to their home state is continued. Divisional Railway Manager of Kota, Pankaj Sharma, told that 10 special train services have been operated for Bihar and Jharkhand so far, in which about 12,000 students have been travelled to their destinations. Jitendra Dwivedi, AIR News, Jaipur.
In Jharkhand, 10 positive corona cases have been reported in a single day late last night. Dumka district has also come into orange from green zone after 2 positive cases were reported for the first time. 2 patients testing positive have recently returned from Gurugram. With this, 50% of the districts have now become affected with coronavirus infection. Total number of active cases of COVID-19 in the state stands at 89, while 33 patients have recovered from the disease. With more number of migrant labourers returning from red zone marked areas and severely hit states every day, it has become a growing concern for the state authorities to contain the spread of COVID-19. Meanwhile, the return of stranded and migrant labourers stuck in other states is continuing. 3 more special Shramik trains have reached Ranchi, Dhanbad and Daltonganj from Ernakulam in Kerala, Surat in Gujarat and Ludhiana in Punjab, bringing altogether around 3,500 migrants from different states. More trains from Andhra Pradesh, Maharashtra, Tamil Nadu, New Delhi, Karnataka and Madhya Pradesh are also scheduled to reach Jharkhand over a week.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Over 39 crore people receive financial assistance of 34,800 crore rupees under Pradhan Mantri Garib Kalyan Yojana. Karnataka announces 1,610 crore rupee package for farmers, construction workers, weavers, auto and taxi drivers. Government extends time limit for annual GST returns for the financial year 2018-19 till 30th of September. Prime Minister Narendra Modi takes detailed review of current status of India's vaccine development, drug discovery, diagnosis and testing for COVID-19, and recovery rate of COVID-19 patients reaches nearly 29%. For quick news updates round the clock, follow us on Twitter handle at AIR News Alerts.
Prime Minister Narendra Modi has taken a detailed review of the current status of India's efforts in vaccine development, drug discovery, diagnosis and testing related to COVID-19. Over 30 Indian vaccines are in different stages of development, with a few going on to the trial stages. In drug development, 3 approaches are being taken, which include the repurposing of existing drugs. Secondly, the development of new candidate drugs and molecules are being driven by linking high-performance computational approach with laboratory verification. Thirdly, plant extracts and products are being examined for general antiviral properties. In diagnosis and testing, several academic research institutions and startups have developed new tests, both for the RT-PCR approach and for the antibody detection. During the meeting, Prime Minister Modi took note of the extraordinary coming together of academia, industry and the government, combined with speedy but efficient regulatory process. He desired that such coordination and speed should be embedded into a standard operating procedure.
A total of 2,958 new confirmed cases of novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 49,391. Health and Family Welfare Ministry said that 14,183 patients have been cured so far and the recovery rate has reached 28.71%. During the last 24 hours, 126 deaths have been reported, taking the nationwide toll to 1,694. A Health Ministry official said yesterday in a briefing that the lockdown has yielded very positive results and the doubling time has improved from 3.4 days before lockdown to 12 days now. He said, at the same time, it is important that the momentum is sustained.
लॉकडाउन के बेनिफिट्स को बनाए रखने के लिए हमें सबको मिलकर यह इंश्योर करना होगा कि हम सब अपनी सोशल रेस्पॉन्सिबिलिटी को समझें और लॉकडाउन ईज होने के समय पर भी सभी प्रोटोकॉल और गाइडलाइंस का डिलीजेंटली पालन करें। देयर इज ए वेरी फाइन लाइन, कॉम्प्लेसेंट होंगे तो फिर से केसेस की संख्या बढ़ सकती है। दूसरी ओर जिन जिले में केसेस अभी तक रिपोर्ट नहीं हुए हैं वहां पर अगर केस आएंगे तो वहां पर फिर से रेस्ट्रिक्शन लागू की जा सकती हैं। हम एक नए नॉर्मल में ट्रांजिशन कर रहे हैं। जरूरत है कि हम सब लोग सावधान रहें, सजग रहें और सतर्क रहकर कोविड-19 से निपटने की अपनी तैयारी को इसी स्पीड और मोमेंटम के साथ बढ़ाते रहें।
The official said the timely reporting and management of cases is very crucial. He said the government found gaps in some states and these have been addressed after due persuasion. The official said some states had not been reporting COVID-19 cases timely and after persuading them, they have reported such cases. He said it is the reason for the sudden spurt in the number of cases for last 2 days. The official said as government has relaxed the lockdown, every citizen should contribute to break the chain of transmission as part of his or her social responsibility by following all precautionary measures. The Home Ministry official said workplaces must ensure thermal screening and face masks, sanitizers and hand wash in ample quantity. She said work shifts and lunch hours should be such that maximum social distancing is ensured. She added that workplaces and company transport must also ensure social distancing.
In Madhya Pradesh, 1,000 patients have returned home after recovering from corona infection so far. More than 32% of the total patients of the state are getting healthy. Indore has the highest number of 491 people, while the number of patients recovering from corona infection in the capital Bhopal is 377. A report.
In Madhya Pradesh, the number of corona-infected people has exceeded 3,000 marks. Indore has the highest number of 1,681 infected patients. Meanwhile, the state government has relaunched the Sambal scheme for helping poor families. Chief Minister Shivraj Singh Chauhan yesterday transferred an amount of 41 crore 33 lakh to the accounts of beneficiaries of Sambal scheme. The Sambal scheme was launched in April 2018. The scheme aims to provide social security from birth to death to the poor and beneficiaries of scheduled castes and scheduled tribes. The Chief Minister also announced that under the Sambal scheme, rupees 30,000 incentive money will be given to each of the 5,000 children who get the highest mark in class 12th of the beneficiary families. The government will also arrange for their fees for admission to institutions like IIT, IIM, engineering and medical colleges after 12th standard. Sanjeev Sharma, AIR News, Bhopal.
The Assam State Rural Livelihoods Mission, ASRLM, has taken slew of measures in its effort to fight against the COVID-19 pandemic. Apart from generating awareness by lakhs of self-help groups members, over 4,000 groups under the mission are actively involved in preparing face masks. A report.
Over 30 lakh women workforce under the Assam State Rural Livelihoods Mission are putting their best efforts to help the people of the state in this hour of crisis. The self-help groups have so far prepared over 20 lakh face masks and 2.5 crore rupees have been earned by selling face masks. Apart from preparing masks, the members of the groups are also engaged in selling vegetables, fruits, milk, fish and other poultry products. These activities have immensely helped the rural people during the lockdown period. The mission has also engaged their members in facilitating doorstep delivery of financial services to the senior citizens. Manas Pratim Sharma, AIR News, Guwahati.
Roop Lal, working as a labourer in Jammu, has received benefits under various schemes. He said that the benefit payments have provided much needed support to him during the lockdown.
मेरा नाम रूपलाल है, पल्ली डमोद से मैं रामन का रहने वाला, डिस्ट्रिक्ट रामन में है, मजदूरदार आदमी हूँ। मेरा लेबर कार्ड जो है वो बन चुका है, जो कि इसमें 1,000 रुपया लेबर खाते में आया है। तो एक जो किसान का है वो भी 2,000 रुपया आ चुका है कि हमें इस टाइम पे वो काम आए। मैं बैंक में पैसे निकालने के लिए, क्योंकि लॉकडाउन से मजदूरी होने वाली है नहीं, मेरी तरफ से सरकार को शुक्रिया अदा होना चाहिए।
In Telangana, sale of liquor has begun this morning even as the lockdown and night curfew extended till 29th of this morning. Liquor shops across the state have been opened while the state government increased prices by 11 to 15%. The state cabinet has decided to open liquor shops from this morning. However, liquor shops in containment zones are not permitted to open. More from our correspondent.
2,000 liquor shops located across Telangana state have been opened since this morning for the first time ever after Janata curfew was held in the month of March. However, about 15 shops which are in containment zones remain closed in the red zone districts. The state government has justified the decision saying that opening of liquor shops is necessary to prevent people from crossing state borders for want of liquor as neighboring states including Andhra Pradesh and Karnataka already opened them. The prices of different types of liquor have also been increased by 11 to 15% with immediate effect. Meanwhile, serpentine queues have been formed by both men and women before the wine and liquor shops from early hours. These shops will remain open from 10 a.m. to 6 p.m. every day. Lakshmi, AR News, Hyderabad.
In Maharashtra, 90 industrial units in Nagpur MIDC too have started their operations. As per the latest data, the state has recorded 841 fresh corona-positive cases, taking the tally to 15,525. The state saw 34 deaths, taking the death toll to 617. Mumbai has recorded 387 new cases till yesterday and continues to the hotspot of infection. More from our reporter.
While a 90-year-old woman from Thane recovered from COVID-19 infection and was discharged from the civil hospital yesterday, a 71-year-old woman from Nandurbar too was cured and sent home after her test results came negative. A few days ago, a 85-year-old woman from Mumbai suburbs was cured and discharged from hospital. Meanwhile, the Sidco Exhibition Centre in Navi Mumbai has been taken over by local civic body to convert it into a COVID-19 treatment facility and accommodate 1,200 patients. The Central Railway informed on its Twitter handle that one more Shramik special train carrying nearly 1,200 migrant labourers left from Panvel station in Navi Mumbai for Rewa in Madhya Pradesh in the wee hours today. Despite being declared a red zone, the district administration of Nagpur has been successful in opening 90 units in city's industrial area. Sonali Ghadiyar Patil, AIR News, Mumbai.
Kerala comes up with a novel idea of fibre-glass separation in taxis, separating the driver and the passenger as part of the COVID preventive measures. A report.
As part of the lockdown phase 3 relaxations, taxi service is permitted in the non-hotspot regions of the state. As Kerala is also gearing up to welcome the non-resident Keralites from abroad from tomorrow, and as more stranded people from other parts of the country is also entering the state in large numbers, extra caution is the need of the hour. In this situation, the Ernakulam District Administration Kerala came up with the idea of using fiberglass separation in all taxis. They had demonstrated the use of the same in the taxis in Cochin Airport. Fiberglass will be separating the driver and the passengers. Only 2 passengers are permitted other than the driver. Driver will only be allowed in the front portion of the vehicle, who needs to wear mask and gloves. Masks are compulsory for all passengers as part of the general COVID guidelines. Mayusha for AR News from Thiruvananthapuram.
In an effort to guard against fake news being circulated on various platforms, we bring you a segment on fact-checking and mythbusters. The government has denied issuing Google Forms titled Rescue Flights from India for Stranded Indians. It has rejected as fake a WhatsApp message circulating with links to this Google Forms. In a tweet, Press Information Bureau clarified that Indian government has not issued any such forms. It has advised people not to click on these links and to register only through the official embassy website.
In our series, Experts Speak on All India Radio, we bring you the views on the leading medical experts on COVID-19. Talking to AIR News, Dr. Rakesh Garg of All India Institute of Medical Sciences, Delhi, said that public support is very crucial to contain the spread of COVID-19.
At this juncture, the support of the public at large is very, very crucial. Those who have any contacts, they need to have self-quarantined. If they are having some severe symptoms, they need to report themselves so that they can be taken care of and the further spread of the COVID-19 can be taken care of.
Dr. Sanjay Pandey of GB Pant Hospital, Delhi, said that the symptoms of the coronavirus are upper respiratory tract infection, sneezing and cough.
In a common flu and COVID-19, the initial symptoms are same. Like patient has upper respiratory tract infection, like running nose, sneezing, cough. But in 10 to 15% patients of COVID-19, there can be some respiratory problem, and these problems are more common in elderly patients and patients who are having some underlying disorder like hypertension, diabetes. So this is how we differentiate between the two conditions.
Indian scientists and researchers are using several tools and approaches in the fight against COVID-19. Hyderabad-based Center for Cellular and Molecular Biology is one of the major laboratories which is doing testing of COVID-19. In an exclusive interview to AIR News, Director of the Premier Laboratory, Dr. Rakesh Mishra, said CCMB is the only center in the country which is pooling the samples.
What we have done is we have introduced a concept called pooling, and in fact we are the only center in the country that is pooling the sample, which means if the occurrence of the disease is less than 2%, less than 3%, then you can pool 5 samples in one pool and then test, for example, then 100 you can test in pools of 20. So by doing 20 tests, you can know the result of 100. If all of them are negative, then it is by doing 20 tests, you saved 5 times the money and the time.
Mizoram's Health Minister Dr. R. Lalthangliana has said that the last test of the single patient from the state has come negative. 4 consecutive tests were done on the patient last week at Zoram Medical College, and the samples had also been sent to Silchar Medical College testing lab for further confirmation. The Health Minister further said, since the patient is still weak after the illness, he has not been released from the hospital. The patient, living in Mizoram, was found corona positive on 24th of March after travelling back from Netherlands.
Renowned actress and BJP MP Hema Malini has appealed to the people to remain indoors and follow social distancing to keep coronavirus away.
सभी वर्ग के, सभी उम्र के लोग अपने अपने घर में रुके। यही तो सच्ची देशभक्ति है। तो आइए अपने परिवार को वो खुशनुमा पल दीजिए। घर में रहिए और कोरोना को घर से बाहर रखिए।
The government has said that no data or security breach has been identified in Arogya Setu. The clarification of the government came after an ethical hacker raised concerns about a potential security issue in the app. The app is the government's mobile application for contact tracing and disseminating medical advisories to users in order to contain the spread of COVID-19. Dismissing the claims, the government said no personal information of any user has been proven to be at risk by this ethical hacker. The government said it is continuously testing and upgrading the systems. Team Arogya Setu has also assured everyone that no data or security breach has been identified. The app fetches users' location and stores on the server in a secure, encrypted, anonymized manner at the time of registration, at the time of self-assessment, when users submit their contact tracing data voluntarily through the app. On another issue, that users can get COVID-19 stats displayed on the home screen by changing the radius and latitude, longitude using a script, the government said that all this information is already public for all locations and does not compromise on any personal or sensitive data.
Producers Guild of India PGI is formulating guidelines for resumption of shooting of films once the coronavirus pandemic settles down. In a statement, PGI said they are working on the guidelines and government and medical professionals will be consulted before finalizing the draft. The document is likely to request actors to do their makeup and styling at home, while producers will be requested to provide masks to all crew members.
Indian Council of Medical Research ICMR has said that a total of 12,76,781 samples of COVID-19 have been tested by various government and private laboratories in the country so far. ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 321 government laboratories and 118 private laboratory chains have been given approval to conduct the test for COVID-19. Israeli Defense Minister Naftali Bennett has confirmed that the Israel Institute for Biological Research, IIBR, has developed an antibody or passive vaccine which can attack and neutralize the virus responsible for COVID-19 within the bodies of those infected. Last month, IIBR started testing its antibody-based vaccine prototype on rodents. And now, before we end the bulletin, the headlines once again. Over 39 crore people receive financial assistance of 34,800 crore rupees under Pradhan Mantri Garib Kalyan Yojana. Karnataka announces 1,610 crore rupee package for farmers, construction workers, weavers, auto and taxi drivers. Government extends time limit for annual GST returns for the financial year 2018-19 till 30th of September. Prime Minister Narendra Modi takes detailed review of current status of India's vaccine development, drug discovery, diagnosis and testing for COVID-19. And recovery rate of COVID-19 patients reaches nearly 29%. And with that, we end the midday news.